Wait.
You want to mention?
Let me do it. Let me do it. Otherwise, it's not going to work right. Okay.
Are there complications with that? Could there be complications with any of these procedures?
Like any surgical procedure, there's always the possibility of side effects. Got to remember again, FDA said PRK is safe. Okay? LASIK is not an FDA-approved procedure. That may sound startling to you. Even though we're using the excimer laser, we're not using it the way it was originally designed to be used. The excimer laser with PRK was designed to be used on the surface of the cornea. Now we're in LASIK, we're taking the cornea, we're splitting it, raising a layer, and treating that layer on the underlying layer with the laser. That procedure, LASIK, is not approved. It's called technically, its use is called off-label use. In other words, even though it's not approved by the FDA, a doctor can use this technology, the laser technology, for an individual patient in the form of LASIK if he feels it's in the patient's best interest. Now, a two-step procedure is more complicated than a one-step procedure, and some of the drawbacks right now is that number one, it's not as accurate as PRK. We don't have the experience with LASIK that we do from 10 years of experience worldwide, with over 1 million people being done worldwide, that we do with LASIK now. That's one thing. So it's not as predictable. It's not as accurate. There are some complications that may occur as a result of making the flap, and at least theoretically, those complications probably can be more significant than we can possibly see with just treating the surface of the eye, like, for example, with PRK.
What's on the horizon for refractive surgery?
Well, I think further improvement in the LASIK procedure, which seems to have caught the public's interest, number one, making it a safer, better procedure, at least to measure up with PRK. PRK is our benchmark for all kind of laser vision corrections. Again, approved by the FDA, can be used over 99% of patients who wear glasses, for example. LASIK has to get to that point. As well as quicker healing, it's got to be safer and it's accurate. I think that's what's going to happen with LASIK. We're also going to see a variety of some new lasers coming out. And in theory, they may have some improvements. We might get better results, perhaps. But I can't imagine any laser that I know now that's before the FDA that can offer any improvement over the Vizix Star laser that I use now, performing PRK. So I think a change in technology, I think we're thinking of like maybe 10 years from now, perhaps.
So there's really no reason to wait.
Oh no, the future is now. There's no reason to wait. We have a very safe, effective procedure known as PRK, approved by the FDA, that is here now, that we've had 10 years experience with. That's been performed over 1 million times throughout the world.
You're on your third laser.
Yes, I am on my third laser.
You've seen huge changes in the technology just in the 10 years that you've been involved with this. You now have state-of-the-art laser, right?
Yeah, well, the technology in excimer laser has changed dramatically over the last decade. We started off with, for example, the first model of the Vizix laser. It was a great model, no question about it. We had a one-year love affair with the Summit laser, and we were kind of disappointed in its limited use. It couldn't be used for stigmatism, or it couldn't be developed into being used for farsightedness. And now we're on our second generation of the Vizix Star laser. The Vizix Star Laser, this is not a commercial. I don't even own any stock in Vizix. However, it is the workhorse of excimer laser and will be for many, many years to come.